more than 8 million people obtained private coverage in health law marketplaces between last fall and April. The rush of newly insured patients, thanks in part to healthcare law and the improving job market, is benefiting hospitals across the country as people come in for surgeries, maternity care and emergency room admissions, among other treatments. For insurers, however, unanticipated costs are racking up and they are increasingly on the losing end. Joining us this morning is WSJ's Chris Weaver. Chris, good morning.
How are you?
Very well. So, just break it down for us. Who are the kind of winners and losers in this? Because it seems as if there's two sides to the story.
Sure. So there's 5 publicly traded hospital companies. HCA is the biggest. They've all seen volumes of patients for things like surgeries, emergency room visits, and hospital stays either rise or, in some cases, the inpatient stays have been about flat. But that's after like quarters and quarters and quarters in a row of losses. Utilization of hospital services declined basically consistently since the economic recession began, and that's turning around in part with the job market and in large measure because the health laws ushered a lot of new people into coverage.
Right. Okay. But the insurers are having a harder time.
Yeah, the flip side of it is that if more people get surgeries, somebody's got to pay for it, and the insurers didn't quite price right. They're a little bit low on prices. They're probably going to have to raise them. And as it stands right now, they're seeing medical spending as a portion of the premiums they're collecting rise.
So does that, does it sort of depend on what kind of surgeries people are doing as they're coming in? I notice there's back surgeries in there, there's maternity care, and things like that.
These are
things that are people picking up on. And is that a pricing factor?
Sure. These are people who have signed up through the health law marketplaces. Both Cigna and Tenet Healthcare, which is having its call with investors today, said that those were categories of surgeries that they see in that population. Those are expensive spine surgeries and orthopedic surgeries or elective surgeries that can really rack up costs. And for young people, maternity care is a great way to generate big hospital bills.
Right, absolutely. I mean, I actually personally had back surgery, and it was a debilitating concern that I had, and actually thinking about that, thinking, in fact, well, the positive side of that, as much as it might be expensive for the system, is that productivity would hopefully be boosted by people who are getting away from it.
Yeah, that's the hope, but it's one of those things where people who might have been delaying care because the consequence was pain and not death, right, are showing up in droves now, and it could be a short-lived phenomenon, or it could be something that lasts some time as more people get coverage.
But in terms of keeping the system solvent, including obviously the insurers, does it mean they're going to have to tweak premiums and get things more in line?
Insurers can fix their problem by raising their prices, and their main issue is that they want to make sure that the amount of money that they make, beyond just medical expenses they got to pay, is high enough, right? It might be okay, but for this portion of the market, if they don't either raise prices or get healthier people in the next couple of years, they could see problems.
Now, of course, there is a major lawsuit that could derail the new insurance law. What would be the impact of that? I mean, would we just see a complete reversal, or is it just too speculative at this stage?
Well, who knows what will happen with that case at this stage? I think a lot of people are betting that ultimately the appeals court decision that said that perhaps some subsidies wouldn't be available for lower income people getting insurance are invalid. I think a lot of people think that will ultimately be overturned. One clear impact that it's having that we're hearing about is that companies that were considering dropping coverage altogether and putting people into these new health law marketplaces are having second thoughts, because it's hard to tell your workers where you can go get a subsidy over here and then have them look on Google and find out.
It's also that uncertainty problem, right? People are never quite sure what's
a big uncertainty.
All right, Chris, thank you so much for your time.